then my electives overlap and my research overlaps. So it's a little more of an integrated program and integrated system, and without trying to get such fragmented training elsewhere. You know, you talk to different residents and fellows and staff, and it was a very highly recommended program to me. And then in contacting various programs, because I'm doing a combined fellowship, they were much more flexible and willing to kind of work with me on that and kind of come up with, you know, planning how my rotations would be, what research would look like, and kind of planning how my electives would work together with all of that. And so it was a very good program, and then had the flexibility I was looking for to do something a little different than the norm. I believe that there are other opportunities for combined fellowships, including critical care and hepatology, nephrology, obviously pulmonary critical care, which is the more standard. And then I believe they're also talking about doing some critical care, both adults, so medicine, critical care, and pediatric critical care combinations. So the one thing that's really nice about Mayo is that they really do have a mentoring program that they set up early that's effective, where some places, my experience has been in with talking with different fellows and faculty and even just the residents, that they have this idea of a mentor, but it's really never a cooperative functioning program. And actually, in the application process, that was very highly stressed, and doing a combined fellowship with critical care and ID, I have a mentor from each side. So we're kind of all working together, so I have 2 mentors instead. But that's really nice and helpful to try to do something, kind of help with the research side, and if there's certain areas of critical care or infectious disease I want to work with, I have someone that I can email currently, you know, or talk to when I'm there about how do I do this, you know, who do I talk to, how do I manage that, and they seem to be both very adequately able to help and excited to help with the fellows. So the flexibility of Mayo Clinic's fellowship programs between the critical care department and with the infectious disease department made it all the difference. I talked to a lot of different programs around the country, and it's very hard to find a program that's willing to be flexible with what your interests are and to kind of cater towards what you might want to do in the future. And there was so much option, like with flexibility of how to rearrange my schedules, how to try to combine things, how to put research together instead of separating it, that it just seemed like it was going to be a great fit because I could really kind of cater down to what I wanted to do and not have extraneous things because of their inability, the inability of other programs to do that. I would recommend doing a fellowship in critical care at Mayo. I think 2 of the big things really for me were, one, I think you become very well trained. I think they do a great job of going across the spectrum of critical care and training you in medical ICUs, surgical ICUs, mixed intensive care units, and also training you in the appropriate procedures very well with their simulations that they do and with the way they round, doing the bronchoscopy time and the echocardiogram time. I think that you become a very well-trained and diverse staff in critical care when you're done with the program. The other thing, again, for me, especially kind of looking at the combined fellowship that I'm doing, is just the flexibility. If there's something you're really interested in critical care, they seem to be able to rearrange your schedule a little bit to be more flexible with, you know, based on your electives or things you might want to do to try to help cater that area that you're interested in.